Good morning, ladies and gentlemen, and may I start with my thanks to the organisers for inviting me to speak at this important event. I hope that your first day yesterday was a success, and I wish you the best for this second day in your event calendar. I am Dr. Elly Hiby, and I am the Director of the ICAM Coalition, and it is my honour to be talking to you about dog population management, DPM, and rabies control. I wanted to start with a quick introduction to ICAM. We were first formed in 2006. Our members are all international charities or international specialist groups. You'll see their logos at the top of the slide here. And our mission is to support the development of humane and effective dog and cat population management globally. We publish joint guidance documents. Here are a selection of 3 of those that are most relevant to this workshop. We run conferences and webinars. All the presentations from our 2023 conference are available on our website's videos, and we are running the 5th in this series of virtual conferences from June 17th to 21st, and I hope you'll be interested to join us for that online. We also host free online courses. The one that is particularly relevant for this audience will be our DPM for policymakers course. There's also a more in-depth course for DPM implementers. And finally, we also develop tools. One example here is Talea, which means count in Latin, which is an app designed for conducting street surveys of free-roaming dogs and/or cats. This workshop has been kindly and quite rightly organised by WOAH, and so let me start by noting Chapter 7.7 of the Terrestrial Animal Health Code adopted in May 2022. ICAM's DPM guide was published in 2019, and although longer, more detailed in terms of practical implementation than Chapter 7.7, the concepts are very similar indeed. Both demand a humane approach without compromising animal welfare. Both emphasise the importance of assessment, monitoring and evaluation to ensure you have an evidence base for design and adaptation. Neither promote a single interventional solution, rather a combination of measures to suit local circumstances. And finally, both recognise the differing and important roles of national and local government in DPM. Chapter 7.7 specifically notes the need for an action plan to provide the details of actions which support the implementation of DPM programmes locally and are cohesive with other national action plans, including those for rabies control and elimination. One aspect of DPM assessment and planning that ICAM considers crucial is the understanding of dog population dynamics. So I now want to talk about this in a bit more detail and why this is relevant for us when we are planning how to manage dogs. This is a visualization of basic dog population dynamics. It shows the different subpopulations of dogs or states, and it also shows processes. So demographic processes are part of dog population dynamics. They are the way that dogs arrive and leave the population and how they move from one state to another, including birth, death, movement out of the home, either temporarily in the form of roaming or permanently when lost or abandoned. To understand population dynamics, you need to invest in assessment of the dog population. Article 7711 outlines aspects that should be included in the assessment, and there is additional practical guidance on assessment methods in this ICAM guide. Now, all this assessment may appear to be delaying the real DPM work, but the concept is that once we understand which are the primary processes that act as sources of free-roaming dogs, we can start to prioritise which DPM measure we use, and this may differ not just between country, but between communities within countries, varying between urban and rural, and varying between communities with different religious and economic backgrounds. So if loss and failure to reunite is a significant source of free-roaming dogs, then we want to introduce the measure of identification and registration, as outlined in Article 7.714. And if we find evidence of issues of impulse acquisition or supply of puppies with poor health, behaviour and welfare, leading to subsequent abandonment, then we need commercial breeding controls. It's very likely that we will find unwanted births and the need for reproduction control, but in which dog subpopulations? If it's own dogs, then we may be looking to increase access to sterilisation, possibly encouraging uptake with subsidising sterilisation costs. If breeding is mostly within community dog populations, then we are looking to catch, neuter, vaccinate and release, or CMVR, with strong community participation and action to access and provide post-operative care for their community dogs. And if it's unowned dogs that we will be dealing with, then we're going to be looking to run a CMVR programme that engages expert handlers. I did want to note that many measures of DPM are actually not about altering dogs, but actually altering what people do with dogs. As a domesticated species, the population dynamics of dogs is strongly influenced by human behaviour, and so employing methods of human behaviour change within the design of DPM measures will be important, including when working on how to promote responsible dog ownership, as defined in Article 7.7.17. Many countries manage their dog populations, at least in part using a shelter system for reuniting and rehoming, and this measure can be effective if there is a realistic chance of rehoming the dogs, and if there are funds available to run these to a reasonable standard that ensures the dogs are in an acceptable welfare state and that people will actually want to visit and rehome. These are examples of rehoming centres in the UK. People feel privileged to rehome from here. But without the ability to build a widespread practice of rehoming, shelters become sanctuaries where dogs live out their lives, so they quickly filter capacity and cannot take in new dogs. So they are no longer functional in terms of managing the new free-roaming dogs that will continue to appear. And without sufficient funding, the welfare standards can become very poor indeed. In both cases, the financial resources required are sizable. CMVR is described in Article 7.7.19. This is an option for managing dogs in situ on the streets, hence an alternative for a large shelter system. It addresses one source of future free-roaming dogs by preventing breeding of those that are already unowned or community-owned. I'm not going to delve far into this particular measure because I know that John Peever will do an excellent job of this in a later presentation of today. But suffice to say, if rehoming is unlikely, then CMVR provides an alternative way to manage these dogs in situ on the streets, steadily bringing their population down in size and in the risk and nuisance they may present to local communities. From this point onwards, I would like to focus on the Chapter 7.7 recommendation for a national action plan. The concept of this national plan is to identify and commit to those actions that are going to directly help to manage dogs, but also enable local government and NGOs to implement their actions, because it is at the local level that direct dog interventions tend to happen. As I mentioned previously, Chapter 7.7 encourages the use of a multi-stakeholder advisory group in the writing of this plan, including veterinarians, public health experts, experts in dog ecology and behaviour and education and human behaviour change. The strategy sets the goals and objectives, but also the principles which guide the selection of strategic interventions. Article 7.7.4 provides a starting point for these principles, which may be added to for local context. The strategy will also describe the current state of the DPM programmes in the country and the gap between that and the goal state. The strategic interventions are those actions taken at the national level and local level that really bring DPM measures to life. They take DPM from where it is currently to a more effective future state. For example, if you find evidence that sterilisation rates are too low because there is insufficient provision of sterilisation services, then you want a strategic intervention that addresses this gap, using actions such as veterinary training or funding programmes to subsidise sterilisation services and human behaviour change campaigns to increase uptake of those services by owners. These strategic interventions need to have a clear, responsible authority, timelines and targets. Over the next few slides, I'll be describing some areas of strategic intervention that may be relevant. Legislation will need to enact DPM principles, including the obligation for humane handling during implementation and allowing some flexibility in how local authorities implement measures in their local communities. DPM-related legislation may exist in different acts. For example, legislation that outlines responsible owner behaviour may be covered by animal welfare acts with associated codes of practice. Identification and registration and the control of commercial breeders, both outlined in the articles you see here, are two areas that should be part of national government action for DPM. For example, an identification and registration system is obviously more effective and efficient if implemented with the benefit of a centralised database. So when it comes to strategic interventions, there may be a need for review and redraft of DPM-related legislation, or it may be that the wording is just fine, it's the implementation and enforcement that is lacking, and this requires a very different intervention. I'd like to share with you now an example of Zero Strays project, a national intervention in Greece. The project recognised the main source of free-roaming dogs was from homes, but the focus had been on sheltering and CMVR, which is tackling the symptom, not the cause. In this slide, Celia, who delivered a presentation on this project at our 2023 ICAM conference, has shaded in green all those actions that should prevent dogs reaching the streets in the first place. And although the legislation to address responsible ownership was relatively good, it was not being implemented or enforced. And so they developed a training programme for municipalities, the police and the judiciary to really ramp up their enforcement of the legislation, and also the service provision to owners so that they could get their animal microchipped and sterilised as outlined in the legislation. So in this example, the strategic intervention was not to change the legislation, but to improve its implementation. If you're interested to learn more, please check out the video presentation by Celia on our 2023 ICAM conference webpage. In most countries, there will be a need to increase the use of reproduction control services to reduce unwanted litters and abandonment. Closing the gap here very often involves improving the skills of vets to perform surgical sterilisation safely and efficiently. I've given an example here of a standard for surgical sterilisation that can be used and a link to a set of videos that can be useful for training. I also wanted to share the example of a national veterinary training programme that was implemented in Bosnia. An international NGO, Dogs Trust Worldwide, partnered with the main vet school to set up a surgical training venue at the school and provided training to the professors in best practice efficient surgical spay and castration. Training was then provided to graduated vets that wanted to be part of a new neutering programme of both owned dogs and free-roaming dogs as part of CMVR campaigns. If they wanted to join these programmes, they had to attend and pass the training. This was a business incentive for the vets and became recognised as a high-quality training course. Over the last 10 years, 239 vets and 252 vet techs have taken the training, and all the vet students passing through the vet school have similarly benefited from the training because of its location and engagement of the vet school professors in the training programme. This has led to quite a steep increase in the number of vet clinics offering small animals veterinary services, and also an increase in the percentage of owned dogs that reported to be sterilised. It is also necessary to provide training to those paraprofessionals that make DPM possible, including vet techs and animal handlers. Even once trained, veterinary professionals need access to medicines and equipment to perform surgery to a high standard, including safe anaesthetics and analgesics. And these essential medicines are not always accessible. Again, national authorities have an important role to play here to make these medicines legal and accessible within the country and not at an exorbitant cost. The World Small Animal Veterinary Association has recently updated its essential medicines list, and this is a good place to start for assessing whether there's a gap in accessibility that needs to be addressed in the National Action Plan. I mentioned earlier in the presentation the importance of assessment so you can ensure your DPM measures match your dog population dynamics. But our assessments often leave us with assumptions about dog population dynamics and the human behaviours that drive them. So monitoring allows us to track whether what we are doing is having the impact we desire, and evaluation are those moments when we review what we've learned from monitoring and adapt what we are doing for greater effect. At the National Action Plan level, an appropriate strategic intervention would be to establish methods of monitoring and provide training in monitoring at the local level, followed by regular evaluation events across local authorities to support peer-to-peer learning. Article 7712 provides a list of potential indicators, and I've already mentioned before the ICAM guide on monitoring and evaluation that can help you with more detailed practical advice on methodologies. The final important role of the National Action Plan that I want to talk about today is how the plan should clearly state how DPM contributes to rabies control and work to maximise the beneficial overlap, also by excluding practices that are counterproductive to rabies control. The primary contribution of DPM is through keeping vaccination coverage high. To explore the mechanism by which it does that, let's go back to basic epidemiology. We all know about the basic reproduction number, or R0. This tells us on an average how many individuals an infected individual can infect. So when R0 is greater than 1, as we see in this animation, the number of infections increase. When R0 is equal to 1, the number of infections remain stable. And when it's less than 1, the infection decreases. And we can see that R0 can vary widely with different diseases. Here we have a range of human diseases. We have MERS with an R0 of less than 1, explaining why this infection died out. We can also see COVID-19 with an estimate of R0 from early in the pandemic. And we have measles here with a very high naught indeed, estimated to be between 10 and 15 new infections in every infected person. And here we have two animal diseases, rinderpest and FMD, with an R0 of 5 and 10 respectively. And finally, we have the R0 of rabies. On average, a rabid dog will spread the virus to 1 or 2 other dogs, a reassuringly low R0 for which we can all be grateful. So what leaves these different values for R0? Well, R is influenced by 3 factors. One is its transmissibility. If there's a contact between 2 animals, will the disease be transmitted? Next, we have the contact rate, which is how many contacts happen over time. And then how long you are infected for, the duration of infection, and in particular the duration of infectiveness. Now, if you can decrease any of these, then you start to reduce R, the effective reproduction number. And now we're talking about R, not R0, and R is the expected number of infections in a population that is under intervention, no longer naive and totally susceptible. And the closer we can get R to 0, the faster we can eliminate the disease. So now let's look at the tools we have available to us in the veterinary community to influence the R of rabies in dogs. So first we have the oldest tool, stamping out to reduce contact rates. Experience has shown this is pretty much impossible to achieve with an endemic rabies infection in dogs. This is not just culling a few, this is elimination of all the infected and susceptible animals, and you just can't reach enough of the dog population to achieve this. Note also that it does nothing to transmissibility or duration of infection. Here we have our usual culling response, which in reality what attempts to stamp out becomes. If it's the culling of a few easily accessible dogs, and often a relatively small proportion of the total. Again, no impact on transmissibility or duration of infection, and the impact on contact rates varies. So you may get a transient reduction in contact rates if you've worked really hard at your culling, but often you don't. Dogs are social animals, they continue to search each other out even if they have to travel further to do so. And in some situations, perhaps best illustrated by what happened in Bali in 2009, people may start to move their dogs to avoid culling teams, in effect increasing contact rates, and in the Bali situation, seeding rabies across this previously rabies-free island. Next, we have vaccination, which reduces transmissibility and the duration of infection. In fact, it brings the time of infectiveness down to 0 because the dog's immune system kills the rabies virus without the virus ever having the opportunity to infect another animal or person. Then we have sterilisation, which on its own does nothing to transmissibility or duration of infection, but can potentially reduce contact rates if we think about breeding behaviours. But the main benefit of sterilisation comes in supporting vaccination as a disease control tool. And then we have rapid response to suspect dogs, where you are trying to identify dogs suspected to have rabies and remove them from the population before they have a chance to infect another dog. So the duration that they were infectious within the population is reduced. This is an important tool, but not one I will be talking about much today. So I'm going to go back to vaccination now with its double impact on the R. So to use vaccination disease control, you need a vaccine that works. And we have a vaccine that is efficacious for every strain of rabies anywhere in the world. And that is wonderful and unique. And these vaccines are very immunogenic so that we get long-lasting immunity as well, if you choose the right vaccine. And we have 2 or 3 vaccines now that can provide 3 years of immunity with 1 dose. And we need one that is affordable and available in sufficient quantities. The per vaccine cost when buying in bulk is just cents per dose, and we have vaccine banks available from WOAH to support large-scale campaigns. And I don't think we should underplay how important these 2 points are. Remember the desperate scrabble for vaccines for COVID and how that continues today with vaccine inequity. For rabies, we are in an excellent position as far as dog rabies vaccine is concerned. So we have this great vaccine, and now the question is, how many dogs do we need to vaccinate to achieve herd immunity to prevent spread? And to work that out, we go back to R0. The percentage of the population that needs to be immune to prevent spread is 1 minus 1 over R0. The lower the R0, the lower the herd immunity required to control the disease. So if we take the average R0 for rabies of 1.5, we get an average herd immunity of just 33%, with a range from 20 to 45%. Just for a moment, let's compare this to another disease with extremely high R0, like measles. The herd immunity for measles is around 93%, which is a tough target to reach. But let's also remember rinderpest with an R0 of 5 and hence a herd immunity of 80%. And this was successfully eradicated globally through the actions of the veterinary community, so this can be done. So why have we not eradicated rabies? Quite simply, the answer is that we have not focused enough on vaccinating dogs. The success of rabies control in both Europe and Latin America shows that this is possible with sufficient political will and investment in vaccination. But in many regions, we have simply not exceeded that critical herd immunity for long enough. But I hear you shout, hang on, what about this 70% vaccination that I hear everyone talking about? And that percentage is absolutely correct. This is the target vaccination for an annual vaccination campaign, which ensures that herd immunity does not fall below critical levels between campaigns. And that fall is the result of vaccinated dogs dying and immune naive puppies being born. This is population turnover. So in this graph, we see the proportion of vaccinated dogs rocket up during the annual vaccination campaign and then slowly drift down over the coming months before it's boosted back up again at the next annual vaccination campaign. Note the proportion stays above this dotted line, which is the critical herd immunity. So how can we use DPM to support our vaccination efforts? The first way to do that is not to cull. The most accessible free-roaming dogs to vaccination are also often the most accessible to culling teams. So in addition to losing support from the community and potentially encouraging movement of dogs by people, culling is also a risky strategy for those precious vaccinated dogs. We want those vaccinated dogs to survive so we can make the most of the immunity we've given them. And this is also where improving responsible dog ownership and care provided to dogs can really help. If your DPM includes reproduction control, then you will be preventing the birth of susceptible puppies. So in effect, what we can do with DPM is make this fall in vaccination coverage more shallow, ensuring it doesn't fall below that critical herd immunity, giving us some breathing space between vaccination campaigns and making our vaccination that bit more effective. I also wanted to show you this line. Now this is what can be achieved for a free-roaming dog population, not with annual mass vaccination, but with all year round CMVR. You can bring the proportion of vaccinated and sterilised dogs up over a period of time, and if you keep maintaining your CMVR effort, you can keep the population at this level, well above the critical herd immunity. I wanted to take a moment to talk about epidemiologically relevant dogs. From the perspective of the rabies virus, not all dogs are equal risk. Dogs that roam freely are likely to have the greatest contact with other dogs and therefore opportunity for viral transmission. Hence, if vaccinated, these free-roaming dogs then have the greatest ability to act as a barrier to prevent further spread. But dogs are also not equal in their likelihood of being vaccinated. Studies have shown that adult dogs that are confined are more likely to be vaccinated through traditional vaccination delivery strategies such as central point campaigns. And this illustrates how the likelihood of vaccination tends to run in the opposite direction to the likelihood of being involved in transmission. The most valuable dogs are paradoxically the least likely to be vaccinated. Vaccination campaign approaches that target free-roaming dogs of all ages and levels of ownership brings vaccination coverage in line with epidemiological relevance. These approaches include door-to-door campaigns, engaging the support of dog feeders to identify and handle community dogs, and then using expert dog catchers to catch the remaining unmarked and therefore unvaccinated dogs in the street. And it's these same epidemiologically relevant dogs that are often most targeted by DPM, whether it's community dogs or unowned dogs targeted for CMVR, or the delivery of low-cost vet care for dogs owned by the poorest members of the community. who are also those people that are the least likely to have dog-proof fencing and hence their own dogs that are allowed to roam freely. Another way that DPM could help rabies control is by reducing contact rates, but how you do your DPM really matters here. A lot of data on this because contact rates between dogs undergoing different types of DPM, including traditional stray control methods that are tended to lean on culling, is understudied. But suffice to say, we want a stable population of dogs with minimal movement. And we know there are a few ways of implementing stray control that can cause perturbation of the population. So both culling and relocation will lead to movement of the remaining dogs and associated increase in contact rates. And in the case of relocation, new contacts will be made in whatever location the dogs are dumped in. So instead, we want to reduce the motivation to move. So sterilisation to reduce breeding behaviours and the associated high contact rates, and encouraging better provision by owners and carers so that their dogs have less need to roam to meet their nutritional needs. I did want to pause momentarily to point out that DPM has many objectives and can therefore deliver many benefits in addition to rabies control. So although rabies control may be a motivating factor, it won't be the only one. Many of the local authorities I've worked with were more interested in reducing the numbers of dogs and nuisance complaints. And therefore the funding for DPM is not only from rabies control budgets, rather it's part of local government budgets, wider public health or urban development budgets. Importantly, DPM should never take away funding intended for mass rabies vaccination. It should be used to bring more money and stakeholders to the rabies control mission and not take away. I wanted to finish by addressing the issue of culling and also euthanasia and how these may be addressed in the action plan. I've just described the mechanics of how culling can damage rabies control, and this is echoed in the WHO technical report on rabies control. This establishes the need for mass vaccination as the mainstay for rabies control and the importance of avoiding mass culling, not just because of the ethical challenges of mass culling when vaccination offers an affordable, humane alternative, but also because it doesn't work. The WHO describes culling as ineffective and counterproductive, especially when culling is targeted towards free-roaming dogs. The WOAH standards on DPM, Chapter 7.7, express a similar principle, a call to the veterinary community to implement dog population management without compromising animal welfare. It also specifically states that euthanasia is not a measure for dog population management nor rabies control, but it does clarify that euthanasia has a role to play in the implementation of those DPM interventions, DPM measures that have direct animal intervention, such as delivery of vet care, reproduction control and sheltering. And the final article of Chapter 7.7 provides recommended methods for humane euthanasia. So there may be the need for strategic intervention within the National Action Plan that addresses euthanasia, including how it should be done humanely and ensuring the right professionals have access to the drugs and training required to carry this out, including when the dog is suspected of suffering from rabies. Experience tells us that inhumane treatment and mass culling is widely opposed by the public, and if we want to engage the community in our DPM or rabies control actions, we need to act humanely and ethically to gain their support. And so the National Action Plan needs to be clear that DPM should be conducted humanely and ethically, and this will include preventing mass culling. I have worked in a country where one ministry was investing in mass vaccination, only to find local governments were culling or relocating the same vaccinated dogs. The action plan should also address using euthanasia when required, with that euthanasia decision made for an individual animal based on its welfare state. Global standards like Chapter 7.7 cannot tell you what your euthanasia policy should be, neither will ICAM, because that policy has to work with the available treatment and management options, and these are not the same in all countries. But ICAM do offer this guidance document that shelters and CNVR implementers can use to develop a euthanasia policy for their situation that takes the dog's current and future welfare state as the foundation for euthanasia decision making. Thank you for your time today. Please note that all the resources I've mentioned today are available on our ICAM website. That includes the conference videos, our online courses and the guidance documents. Please know that 2 of our main guidance documents on DPM and on monitoring evaluation are also available as Arabic translations. I wish you the very best for the remainder of your workshop and would be happy to answer any questions that you have.